Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I've been for about 3 weeks in a lot of pain.
Okay.
That's all on the front of my head, like a rubber band around the back.
Okay.
Lots of pressure in my ears to where I feel like I want to constantly pop them and I can't.
Both of them?
Both ears load up with pressure.
Okay.
And when the pressure gets really intense, it comes down my face. My teeth hurt. My jaw hurts. So eating was uncomfortable during that time.
Eating, okay. So what happened? Did you have any trauma, accidents? What happened 3 weeks ago?
What I think it was is I was starting to have what I felt was a sinus infection, and
Okay.
I flew out of town.
Okay.
And when I flew back, the pressure built up in my ears in the plane, and it seemed to never release.
Okay.
And I don't know if going out of town and taking a couple days off work, I did try to return to work one day after, and it was very stressful. So I might have been very tense at that time as well.
So for the last 3 weeks, what kind of tests did you have, and what kind of treatment?
I've been in and out of the ER, and they've done a spinal tap.
Spinal tap, okay.
2 CT scans, one of the head and one of the sinuses, and an MRI with and without contrast.
Okay, and everything was negative?
Everything was negative.
So they did all the tests, and what kind of treatment you had? What did they give you?
At first they thought that the pressure was coming from the sinuses, so they gave me steroids and antibiotics.
Okay.
They switched my antibiotics multiple times before I could actually finish one of them.
Oh, okay.
And then they decided.
But the MRI and the CAT scan, is it showing that you have infection, or
No.
the blood work showing any infection?
Well, once they had done that even prior to doing any blood work. And then once they did the blood work and the CAT scan, they told me to stop the antibiotics.
Because you don't have infection.
Right.
Okay.
And they first round gave me Imitrex and Flexeril. I took that and it didn't help. And during this time, I was unable to sleep. So I was hoping the Flexeril would make me tired. It did not. And they would give me in the hospital morphine and Dilaudid, and it wouldn't work. And then they finally decided to give me a drug called Topamax that was supposed to relieve the migraine and prevent future migraines. It had horrible side effects for me. My body started to get tingly and numb in certain places. And I was aggressive and agitated and very sleepless. I was not comfortable, so I could not rest.
Are you taking that now or still?
No, I stopped taking that. When I stopped taking that, they then decided to give me beta blockers. And I started taking that for a few days. And it was lowering my blood pressure, so it was making me feel weak and lightheaded. And it didn't seem to help at all. So I ceased at that.
So you tried everything?
Yes.
Okay, sorry about that. Any other treatment?
I then went to an acupuncturist, and she kept putting the needles in and asking if I had relief of pressure or pain, and I never did.
And that's why you have those little bit bruises?
Yeah, I have bruises here, and then also on my stomach.
Oh, wow. Okay. So how much pain and headache you feel right now from 0 to 10?
So I did take a sleeping pill last night, and I finally got, I think, about 4 hours of rest, maybe 5. And so I woke up this morning and I was moving around and I felt a little bit better. So right now I'm about a 5 or a 6 of pain.
Is 5 and 6 constant or comes and goes?
It's when I'm at my least amount of pain, it's a 5 or a 6.
Okay. At worst, how much?
8 or a 9.
8 or 9. Can you just tell me now the pain? Where do you feel it? The pressure and the pain?
My ears feel plugged up.
Okay.
There's a lot of pressure in my ears, down here in my jaw.
Okay.
My teeth, the top teeth a little bit.
Okay.
And then behind my eyes and around the back of my head.
And that's 5 and 6 now?
Correct.
Okay. Make sure everything is pain-free. Okay. You feel it like a band here. Okay. Is that too much?
No.
Okay. So that's really fascial restrictions. Can you release it? Should move like this. So you said you had a trauma here before? In your eye?
On my eye, yes.
Okay, what happened?
I was headbutted playing soccer, and it split my eye open.
When did that happen?
About 4 years ago, maybe.
4 years ago?
Yeah, maybe close to 5.
Yeah, so you had sutures there?
Yes, three stitches.
Yeah. And that's where you feel the pain?
The most pain, yes.
You feel pain from what I'm doing?
Yes. I mean, it's pretty sensitive.
If your pain level is the same, that's fine. If your pain level increases from what I'm doing, make sure you do.
Okay.
Okay? Did you feel nauseous, dizzy, or vomiting during this time?
I got nauseous periodically. I never actually vomited, but I would get dizzy, and it would be like foggy, blurred vision.
Okay. Do you have that today?
No.
Okay. Is that when you start to go to the ER?
Yes.
The symptoms? Yeah. Blurred vision.
About 8 years ago, and he pointed it out and told me I needed to definitely wear a mouth guard at night. So I'm on my 3rd mouth guard because I usually grind so much I break them.
Wow. Okay. And that's why you have those teeth sensitivity from a lot of clenching at night.
Yes.
Do you hear her at night?
Sometimes. Sometimes, you know.
So if her head is twisted, she starts to clench more?
I think so, yeah. I think when because she sleeps on her side a lot, so I think she's grinding it.
Side or the front? Let's look like a front.
When she sleeps like this side. If she grabs a pillow and sleeps this way.
Is your stomach touching the table, the bed?
Sometimes, yes.
That's sleeping on the stomach.
Oh, really?
That is, if your stomach touching like this, yeah.
Oh, okay.
It's like sleeping on the stomach but twist a little bit, not touching on the stomach. Because if you sleeping on a stomach like this, how are you gonna breathe?
Right.
I hope not. You know. So yeah. So we need to change that. Okay.
How do I sleep?
Well, for jaw pain, the best position is the back. You know, if you can sleep in your back, that is the best position. How to do that? Okay. Every time she sleeps on her stomach, wake her up.
Okay.
So you're gonna be awake all night long.
Right.
That's not the solution, okay? Don't do that at home, okay? So did you have any hit in the nose area?
Yes.
What's happened?
I had when I was a kid. I was hit with a wagon handle between the eyes.
Oh my goodness. You're lucky, by the way.
I know. I'm glad I hit there and didn't take an eye.
Oh my goodness, that's crazy. Did you have any like concussion or anything?
I don't think they did any tests for it, but my mom had to keep me up most of the night just to make sure.
Do you wear contact?
I had LASIK. I used to.
Nice. I had LASIK. Okay. A bit too much. This is Oh, okay. Okay, don't bite me. Too much.
Must be pretty tight.
Oh. Yeah, we have some work to do here. So actually, it's not as bad as I thought. So tighten this all closer to here, really closer to her ear.
Right.
Most of her mistake. She feel the ear pressure. It's common with TMJ. So what we have here, TMJ / tension headache / migraine.
Right.
So we're gonna work on all of that. You feel this bump here? You see the tool. This is just a stuck, like not very smooth. Not too much.
It's okay.
Yeah, she has. You feel the scar tissue.
Mm-hmm.
You see that?
Yeah.
See? You see, it's not like going like this. And jumping. That's where she has the scar tissue.
How did you come up with this?
Well, it's a start with my wife used to have TMJ pain. She had it for over 3 years, and I tried with her everything, and she experienced like pain relief 1 to 2 days, nothing lasts. Everything I learned in school, I took a specialty classes, bought a lot of books, nothing will provide long term. So one day she woke up with a lockjaw. She was not able to talk or eat, and she asked me to try anything, and I told her I tried everything. So I reached my hand inside her mouth and I started to experiment. After a few minutes, she was pain-free and her jaw was unlocked.
Oh, wow.
So it took me several weeks after that to understand the concept that I used on her. And after that, I developed over 125 maneuvers to implement the same concept to treat the entire body. During that time, I'm a cancer survivor, so I used to suffer from chronic migraines and headaches, fatigue. So I was not really happy with the outcome. So that's what led me to look for solutions. So I start with working maneuvers, and then my hand was killing me actually from using my hand so much. And 6 months later, I told my wife I cannot do this long term. So she told me, you came up with maneuvers, come up with tools. So I went to hardware store, get the PVC pipes, cut and shave, and came up with the design.
Wow.
Yeah, but the protocol for fatigue, migraines, and all of that, that's from my personal experience, and I start to study more nutrition, more functional medicine, more treating the source of the problem instead of treating the symptoms.
Right.
And that's how I was able to get rid of my migraine. And it was a protocol, I use it with the patient. So it starts like a technique using one element of the problem, like working on scar tissue or fascial restrictions. But I keep adding more stuff. It's a biopsychosocial model that addresses 11 elements of the problem. So, and based on the study, actually, when implementing the biopsychosocial model and addressing the problem from all aspects, that's when you can get good results. Instead of like going to if you want to have like a car tune-up, okay, you want to go to a mechanic that's changed the air filter and says good luck, I just changed the filter, the performance is going to improve, but that's not really good improvement. So that's the problem that I found with a lot of technique. So how we train healthcare provider to change the whole, to do the tune-up, and that's ASTR actually, doing the entire tune-up, the nutrition, the ergonomic, the stress management, the soft tissue, the behavior modification.
That's something I noticed. They always treat the symptoms. They don't really treat the core issue.
Unfortunately, and I personally experienced that, and there's a solution. We have to look for it, or if there's no solution, we have to figure out a solution. Right. Figure a solution. But I like to figure out a solution.
Both of my ears are still plugged with pressure. It's slight on the back of my head, not as bad. And this one's, I can hardly feel right now.
So you still feel in the back. I'm not sure about your ear because I did a test before. Let's have you sit here. For your ear, you have internal inflammation. A couple of tests I did. So it might take us a little while for your ears.
Okay.
So, but now I'm just going to work on the front and the back.
Okay.
I will work a little bit on the ear, but we need to do more other stuff on it, okay? You hear that?
Mm-hmm.
She's like having like a grain,
Is that all
Or-
scar tissue?
Yeah. Well, it should feel like nice and smooth like this. Let me see. Feel how nice and smooth here? It's not perfect, but it's a little bit.
I was feeling his head to see why mine
You
was.
feel how nice and smooth here?
Mm-hmm.
Okay, compare this to this.
Yeah, it's very ripply back there.
Yeah. Yeah. So you should not have this. Usually from poor posture, poor body mechanics, or accident, get a micro tear in the soft tissue and your body starts to build scar tissue. Yeah.
Just very tight.
Yeah, sometimes right here,
Mm-hmm.
the muscles in her are like
It's like a rock.
a rock.
Muscle spasm. Yeah. That's what causes tension too.
I've been trying to use those electrodes on it more often.
Yeah. Electric stimulation is temporary pain relief. We need to get to the root of the problem. Okay, let's move this today. Relax. She has a lot of tightness. Well, here's the problem with this. If you have a lot of tightness here, if you do this, actually it can cause headache because that's compressed on the vertebral artery that go into the brain that provide the blood supply to the brain. So if you block the blood supply and the oxygen level to the brain, it's migraine. And that's overlooked as cause of migraine from scar tissue and tightness here that compressing on the vertebral artery.
Makes sense.
Yeah. So, and how to treat that? Well, you have to mechanically break the scar tissue.
Yeah.
There is no drug gonna break the scar tissue.
Like a 1 or a 2.
Let's drink some more and tell me how that feels.
Was another reason I was having trouble sleeping on my back.
Because that's area.
Mhm.
Because it's very sore to lie on it. Yeah. How does that feel now?
It's good.
Mm-hmm.
It's just very low, dull
And
pain.
let me see the exact spot. Switch over me. What?
Right here, mostly on these 2 points.
Oh. Yeah, it's the two scar tissue she has, 2 bumps,
Mm-hmm.
left and right.
I told you I had a pump there, honey.
Mm-hmm.
Is it too much?
That's okay.
Man, how did you do that? You slouch a lot?
Yes.
Probably.
Oh, yeah. Okay. I'm gonna give you injection. Not really. Okay. So can you tell the difference after the treatment and what do you feel?
I can.
Okay.
The ear's still a little pressure
We're
here,
gonna work on the ear next time, yeah.
but the back of the head, that band, that tightness and that
Mhm.
pressure,
Mhm.
definitely much, much less.
And the front.
And then the front,
So what do you think about the ASTR treatment?
obviously it's working.
Alright.
So,
Awesome.
and you can feel all that scar tissue.
You can feel it, yeah.
Mhm.
It's not like, it's obvious to see, feel.
It is.
Yeah.
You can feel it.
Yeah, awesome.
Thank you.
All right, you're welcome.
Okay.
Thank you. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.